Turning to the major medical dispute in the country, the deadline for recruiting trainee doctors for the second half of the year ended today, apparently with very few applicants. Shin Ha-young explains.
Recruitment for trainee doctors at 126 hospitals nationwide ended on Wednesday at 5 p.m. Since Monday last week, hospitals have been recruiting for 7,645 trainee doctor positions for programs starting in September. Although the government offered disciplinary exemptions for returning junior doctors, very few have applied. These included an exemption from the rule prohibiting residents who resign during their training period from returning to the same position within a year. However, the medical community has largely ignored the recruitment efforts, with some medical professors planning to boycott training programs for junior doctors and calling for the government to scrap its medical reform plan before any negotiations. Health Minister Cho Kyung said on Tuesday that the government is aware of the low application numbers, but reiterated that no additional measures would be taken to encourage returns. The number of applicants to the country's 5 major training hospitals is very low. Some have had no applicants at all, while others, such as Seoul National University Hospital and Samsung Medical Center, had only a few ahead of the deadline. Before the recruitment ended, an official from one of the hospitals said that it was uncertain if the number would even exceed single digits. Amid this situation, resident doctors who have not returned are seeking jobs at private clinics, resulting in a decrease in salaries as more people compete for limited positions. Meanwhile, the Korean Medical Association announced on Wednesday that it has formed a task force to help non-returning resident doctors who are struggling to find jobs. It will connect these residents with private clinics and create a standard contract after determining a salary range that both residents and private clinics can agree on. Shin Ha-young, Arirang News.